Welcome to the deep dive. Today, we're tearing into one of the most consequential institutions in the world, the FDA.
Yeah, and we have a mountain of source material here.
We do. It covers everything from its history to its, let's say, controversial modern role. Our mission is pretty clear. We're talking about public trust, accountability, and what health reform actually looks like.
That's right. The material you shared, it really goes deep. It's about dissecting the actual agenda for transparency, cutting red tape, and maybe most importantly, finally confronting some long-standing medical dogma.
Dogma that's been, you could argue, pretty harmful.
You could definitely argue that.
Okay, so before we jump in, we have to get a sense of the scale of this agency. I mean, the sources say the FDA regulates 20% of the entire U.S. economy.
20%. I mean, just think about that for a second.
Massive.
It's everything from the mangoes you buy at the store to MRI machines, cosmetics, tobacco, and of course, every single drug on the market. It's an immense sphere of influence.
And the origin story is, it's pretty staggering. It shows these institutions are really born out of crisis. The FDA started over 100 years ago because people were literally getting sick.
They were dying.
Yeah, dying from toxic chemicals being legally added to products.
It was an absolute free-for-all. I mean, we're talking about heavy metals, mercury just put right into food. And that fact that always gets people, yes, early versions of some popular drinks had significant amounts of cocaine in them.
Which is where the name Coke even came from.
Exactly.
Yeah.
The agency was born specifically to stop companies from poisoning the public.
So protecting people from poison, that was the mission.
Right.
Let's look at the modern reform agenda now. The sources are saying the focus is on tangible impact and fast. What are the big achievements in the first 8 months?
Well, the focus has been on challenging these, entrenched norms, introducing common sense transparency right away.
Like?
Things like eliminating unnecessary animal testing, making rejected product letters public, which is huge for accountability. But the biggest one, the one that really speaks volumes, is the food supply overhaul.
You're talking about the artificial coloring fight.
Exactly. They announced the removal of all 9 artificial petroleum-based food dyes from the U.S. food supply.
All 9 of them.
And this is a battle that has been debated and stalled for 35 years.
35 years.
And it was done in a matter of weeks. It just shows you the barrier wasn't science, it was just bureaucracy.
Wow. So that leads us right to the next big shift.
Yeah.
Rewriting the food pyramid. This is going to impact every school, every hospital, every military base.
This is a huge philosophical reckoning. I mean, we have to remember the old food pyramid, it was largely written by lobbyists.
By the food companies themselves.
Right. Their goal was selling commodities, not public health. And you saw the result in things like the Food Compass study that suggested Lucky Charms sugary cereal was healthier than steak.
That's the point where you just throw your hands up. The public can't trust the guidance when it's that illogical.
It absolutely defies logic. And the core of this rewrite is ending the 50-year war on natural saturated fat.
Right.
That dogma told us to get rid of natural fats, butter, eggs, meat, and replace them with highly refined carbs.
So we swapped satiating natural fat for high glycemic fillers and sugar.
Precisely. We basically ran a mass experiment. And the result is the chronic disease crisis we have today. We just started pounding our kids with ultra-processed foods.
And that gets us to the really devastating part, the health of our children.
The data is shocking. It should really concern everyone listening. Right now, 40% of kids in this country have a chronic disease.
40%.
And so many are on regular medications. And when you look for the root causes, the new findings point to environmental and lifestyle disruption.
You mean like the mass medicating of kids for ADHD and things like that? What's driving it?
It's a few things, but they all center on this modern lifestyle we've engineered. Ultra-processed foods, yes, but also constant disruption of circadian rhythms.
How so?
Early school buses. Forcing kids to wake up unnaturally early purely for adult convenience. And add to that, a lack of natural light. Our sources point out that the average American child gets less daily sun exposure than a prisoner.
That is a staggering comparison. So we've designed a system that makes them sick, and then we treat the symptoms with drugs.
Yeah, that's the cycle they're trying to break. And one tangible action is the SNAP waivers. The idea is to stop using taxpayer money to fund the problem. States can now stop people from buying foods that are demonstrably bad for kids with those funds.
Okay, let's pivot now. Let's talk accountability, which has been, the most polarizing topic of the last few years. The COVID legacy. There's a deep, deep demand from the public for closure, specifically around Dr. Fauci.
Trust just evaporated. It evaporated when the official guidance was so clearly flawed, or worse, dishonest. A major early error was Fauci just ignoring the basic science of coronaviruses.
What do you mean?
He misled everyone by downplaying the airborne nature of viruses like SARS and MERS, which are also coronaviruses. We knew this. This led to that bizarre advice, right?
The gloves, the goggles, wiping down your groceries.
Pouring alcohol on your mail. All while the primary way it spread, breathing the same air indoors, was downplayed for months.
But the real core of the accountability issue is the origin story. What does the material say about the Wuhan lab?
Our sources call it an overwhelming accumulation of circumstantial evidence. I mean, first, the epicenter was 5 miles from the lab. But the real smoking gun is what they call the cookbook. The lab submitted a grant proposal in 2018, 2 years before the pandemic. In that proposal, they asked for funding to genetically modify a bat coronavirus by inserting a furin cleavage site.
And that's the precise genetic feature that lets SARS-CoV-2 infect human cells so effectively.
Exactly. They were literally asking for permission to engineer the virus that caused the pandemic. That's the cookbook. And then the sources show Fauci and Collins working to get around the gain-of-function moratorium that Obama had put in place.
And that lack of transparency has been compounded by everything around the vaccines and vaccine injuries.
The whole discussion just became poisoned because the official message ignored risk. The sources are clear. Young, healthy people had essentially zero risk of dying from COVID.
But the mandate was universal.
It was universal, which created this huge backlash when complications started showing up in those low-risk groups.
What were some of the specific concerns that people felt were just being censored?
Well, there was the feeling that the FDA was just sitting on myocarditis data. There were findings of virus particles in the breast milk of lactating mothers. And critically, this growing belief that some long COVID cases were actually vaccine injuries that were being ignored.
Which brings us to the athletes collapsing.
Yeah.
The sources reference Damar Hamlin saying, "I know what it is, but I can't say it."
That silence, it tells you everything. The censorship machine, as the sources call it, created this climate of fear where doctors, athletes, anyone, was terrified to even suggest a vaccine complication.
They feared professional ruin.
Total ruin, that all heaven and earth would come down on them. The public needs transparency on this to restore any faith in public health.
Let's shift gears now away from crisis and into the economics of health. The big question is, finding a cure for cancer, say, actually profitable?
So de novo cures, brand new ones, are highly profitable. You get market exclusivity. The reform effort now is about speeding up access to them, using tools like priority review vouchers.
How does that work? How does a voucher cut the red tape?
It's an incentive. A company develops a drug for a really difficult disease. The FDA gives them a voucher. They can then use that voucher on any other drug to get a fast-tracked review. It cuts the process from years down to weeks.
And we're already seeing this work.
Absolutely. The sources point to a drug for certain rectal cancers that it literally melts the tumor away to zero. No chemo, no surgery, no radiation. That's what happens when you remove the bureaucratic barriers.
But the biggest problem with drug prices isn't always the FDA. It's patent law, which Congress controls. How is that system being manipulated?
It's the strategic abuse of the patent system. You get 20 years of exclusivity. But instead of just that, companies do what's called a bum rush.
A bum rush.
They file dozens, sometimes hundreds, of tiny little patents around one drug, a new flavor, a new bottle cap, anything. And these secondary patents create a legal wall that blocks generics for years and years.
So you build a legal moat around the product.
That's a perfect way to put it. It's why a drug can cost, say, $5,900 one day. And then the minute the patents finally die, it drops to $72.
Wow. Now, let's talk dogma. The sources identify what they call the biggest screw-up of modern medicine. That's a strong statement.
It is, and it's deserved. It belongs to the catastrophic demonization of hormone replacement therapy, or HRT, for postmenopausal women. And it all stems from a misinterpretation of a 2002 NIH study.
What was the flaw? Why did doctors suddenly tell women to stop taking it?
The study was flawed because they gave hormones to women who were often 15 or 20 years past menopause. It was too late. But the dogma that came out of it was just, HRT is too risky, period. Doctors took millions of women off it overnight.
And what were the real health consequences of that?
If you start HRT within 10 years of menopause, the benefits are profound. Beyond just alleviating symptoms, you're looking at a 25 to 50% lower risk of a fatal heart attack.
The #1 killer of
It's the
women.
#1 killer, and it's 90% effective at preventing osteoporosis. It reduces cognitive decline. Denying that care has profoundly hurt 2 generations of women.
Just a massive failure. And quickly, what about the male equivalent, TRT?
The same shift is happening. It's moving away from the steroid stigma and into a real health discussion. The FDA is even planning a forum on it because they recognize its role in longevity, and that connects right back to the data. Muscle mass is the #1 predictor of how long you'll live.
Okay, we have to move quickly, but let's hit a few urgent hidden threats from the sources, starting with early puberty.
The change is rapid and it is alarming. In the late 1800s, puberty for girls was around 16 or 17. Today it's 11. And for the last 30 years, that age has been dropping by a week and a half every single year.
A week and a half every year.
Yeah.
That's a huge acceleration. What's causing it?
It's believed to be chronic exposure to chemicals in our environment, in water, in plastics that have estrogen-like properties. They mimic our hormones and they hijack the natural timeline.
Next, Tylenol or acetaminophen, and it's linked to neurodevelopmental disorders. The science has been debated on this forever.
The sources take the precautionary principle here. It's not about definitive proof. It's about minimizing risk. The dean of the Harvard School of Public Health has said there is a causal relationship between prenatal acetaminophen use and things like ADHD and autism.
So the goal is just awareness, minimize use if you can.
Exactly. It's just about informing pregnant people. I mean, Tylenol itself tweeted back in 2017 that they don't recommend using it during pregnancy. The conversation has to shift to informing the public.
Finally, an urgent public health warning. A new opioid danger being sold openly.
This is critical for every parent listening. We're talking about 7-OH, 7-hydroxymetrogenine. It's a concentrated synthetic chemical from kratom, and it's being sold in vape stores.
In gummies, in drinks.
Right, marketed as energy boosters.
Yeah.
And the danger level here is extreme. This is a potent opioid. It binds to the opioid mu receptor 13 times more tightly than morphine.
13 times.
This is not a supplement. It's a highly concentrated synthetic opioid. Parents have to know what this is and tell their kids to avoid it completely.
This whole deep dive, from food dyes to medical errors, it really comes down to one thing. We have to move past politics and just apply logic. Look at the patterns, look at the data, and stop being afraid to offend powerful lobbies.
And that's the challenge. It's the money. The medical sector spent $713 million on lobbying in 1 year. Real progress requires complete transparency and a willingness to stand up to that.
The biggest pattern we've seen here is this: historical reluctance to be honest about origins. When you connect the dots, the Wuhan lab cover-up, the decades of denying HRT benefits, you see this thread of institutional opacity. And as a final provocative thought from the source material for you to consider, think about the origin of Lyme disease. Many believe it came from the Plum Island lab, just 25 miles from Lyme, Connecticut, potentially linked to research by a Nazi war criminal who believed in warfare via infected ticks. Why is the medical establishment so reluctant to be honest about origins, whether it's Lyme or COVID? For faith to be restored, the listener has to demand full closure and full honesty.